Hello and welcome. I'm Steve Clemens, editor-at-large of The Hill. Thanks for joining us for COVID-19 Vaccine, Trust in Communication, a look at the rollout of the COVID-19 vaccine and the role fact-based communication can play in countering disinformation and building trust. Before we begin, I'd like to thank our sponsor, Granicus, for supporting today's event. Among the many obstacles in supplying, distributing, and administering COVID-19 vaccines, the ability to communicate reliably is proving to be an added challenge. A quick look at social media shows how conspiracy theories and falsehoods can easily spread. From fighting misinformation to reaching disadvantaged communities and marginalized communities and broadband deserts, governments at all levels have to find ways to engage, educate, and get the vaccine message out to all Americans. So what does effective communication look like in these times, and how can we reach all communities with accurate information, especially those who are skeptical of the vaccine? To answer these questions and more, we have an exceptional lineup of speakers, including leading public officials, health professionals, and communications experts. Before we get underway, a few housekeeping notes. You can tweet us at The Hill Events using the hashtag #TheHillVaccine. We're broadcasting live. We'll be taking your questions throughout the program. And as with any live stream, and I laugh at this, they say, if anything goes bad, just push refresh and everything will be great. I hope that works for you. Never does for me. My first guest is the White House Senior Advisor for COVID Response, Andy Slavitt, a former acting administrator of the Centers for Medicare and Medicaid Services. Andy, thank you so much for joining us today. You have a tough job right now because, there's this line of high demand for the vaccine that is being rolled out. Now we have the the Pfizer vaccine, the Moderna vaccine, and now the Johnson & Johnson coming online. But we read stories where, something like the Capitol Police, 40% of the D.C. Capitol Police haven't gotten vaccinated because there's hesitancy out there. So my question to you is, when does that line of hyper demand for the vaccine and then the line of skepticism cross, where we need to spend more time really drawing people in to be vaccinated who are skeptical versus the heavy demand for it right now?
Well, look, thanks for having me on. It's good to be with everybody today. Look, part of honest and direct and open communication is to just talk straight, give really simple answers. So we have a shortage. We have a shortage of vaccines today, and Americans are experiencing a shortage. We haven't lived with shortages in this country for a long, long time. That shortage, as you say, won't last forever. It'll be a matter of months. But in that matter of months, we know that creates anxiety for people. And it's important that we tell people like it is, and we try to give people as good an expectation as possible. The answer to your question is it will change based upon, it differs, I should say, based upon communities you live in. In some communities, we're already there. In some communities, we're already we're in past the mode of people who want to take it in the first wave. And I don't think about it as people who want to take the vaccine versus people who don't. I think about people who want to take it in the first wave, people who are fence sitters in the first wave, but will get off the fence for a second wave once they see what's happened in the first wave. Then, a wave of people that have questions that need to get answered individually or collectively, and then I think at the end of it, there's a small group of people, can't tell you how large, but it's not as large as people would estimate, that don't want to take it. And those are, those people tend to have some features in common and some concerns in common. We're learning what those are, and we have to have those conversations with people. But over the next couple of months, we will get through waves of people who have been clamoring for the vaccine, and we will get to a stage where we have to start reaching that next group. I think you'll see us launch efforts at that conversation. Even before we get to that point. So, relatively soon.
Andy, what is your methodology, your dashboard for reaching communities that have been tough to reach in the past? This is an area where there's, not only logistics distance, but skepticism. And, the show we're doing today is probably not reaching those communities. We'd like to, but it's out there trying to reach folks that have not been easy to reach. What are the methodologies you're thinking about?
Yeah, it's a great question, because in healthcare, if you do nothing, people who have the most advantage, the most privilege, the most confidence in dealing with the healthcare system will tend to have much higher access. What we've learned is there are some things that work. You can't just move vaccines into communities that are underrepresented that you want to serve, because if you do and don't do anything else, we learned is that people, if you put a bunch of vaccines into Oakland, left to its own devices, people from San Francisco are going to cross the bridge and take those vaccines. So what you have to do is you have to make sure you're reserving appointments for people who live in the communities, and you have to do special outreach. We launched a pilot with the insurance companies launched this week that's called Vaccine Community Connector, where they're making outbound calls to people who are in marginalized communities, arranging transportation, arranging rides, answering questions about the vaccine, arranging follow-up appointments, and scheduling appointments. So you've got to basically go at those barriers. And if those barriers are transportation, if those barriers are location, if those barriers are trust and who's there to have the conversation, you've got to just take them down one by one. But you have to prioritize it because there's a communities largely this is an occupational disease. This is a disease that affects people who interact with the public all the time. That's why it's hitting certain communities harder. And we have to make sure we're taking care of those communities actively.
Andy, when you were running the Centers for Medicare and thinking about, the infrastructure of what the health picture of the nation was going to look like, how it gets paid for, what the social contract is between insurers and citizens and PBMs and that whole health ecosystem, are we now looking at a kind of new permanent overlay where we are going to have a vaccination infrastructure year after year after year and does that create opportunities for thinking about the social contract in health that we really haven't discussed nationally yet?
Well, that's a hugely insightful question. And you're right. All the things we've talked about for years but never do, prevention, right? Prevention becomes, how much more important does prevention become when you've got people that are at high risk of getting infected? Making sure that people have annual vaccinations. It's not a whole lot different from making sure you throw a blood pressure cuff on people and make sure that they have those. So the one thing I think is that's one big lesson from this. Another big lesson from this is what have Americans not had to worry about during this entire crisis? The one thing they haven't had to worry about is a copayment on their vaccine. Or if am I in my deductible so I can't afford the vaccine? All of those barriers that we set up that prevent people from getting good health care, they were originally set up because we were worried about people getting too much expensive care. What I think we've learned over time is, yes, there's a category of things, maybe, an MRI, the things that get overused, but there's a huge category of things that have been underused. And vaccinations would certainly fall into that category. Primary care visits would fall in that category. So there's a lesson here about simplifying this system, having people not have to worry about, can I afford it when they want to get good health care, that I hope we apply to the rest of the healthcare system.
Are you finding that the use of trusted ambassadors, trusted faces, voices in various Native American community, Hispanic community, Black community is actually moving the needle when it comes to participation rates? Do we have any kind of evidence at all that approach is working? We hear from communities that's what might motivate them. But I'm just interested in whether anybody stepped back and said, okay, in Los Angeles, we did achieve something, in Arizona, in Montana, by using this. And I'm just wondering whether or not in your sandbox, you've been able to see any real movement of participation rates, because we do know from the head of the CDC today that we are still seeing lesser vaccination rates in Black and brown communities than the white community.
Well, I don't think we have actual data on what's happened yet and what's worked. I think we have a lot of data on what people think works, and a lot of people who've studied this question, and what they'll tell you is local doctors and pharmacists are very important in the equation. Local doctors and pharmacists who look like the people they're communicating with are important because they understand their reality. Getting straight answers to simple questions is a must. People don't want to be persuaded or convinced. Your employer and the people you know in your world are very important because if you're sitting on the fence, that's really useful for you to know. Celebrities, they may attract your attention. They may get you to pay attention, but they might not necessarily convince you to get vaccinated, except for Dolly Parton, of course, who I think should be persuading everybody with all the stuff she's doing. So I think that there's also a certain subset of folks who they really don't want to feel the top-down pressure. Top-down pressure won't help them. So if it's coming from the government, or it's coming from the pharmaceutical industry, or it's coming from a celebrity, even someone they relate to, that may cause them to trust it even less. What they really want is they want to know that they've got the freedom to choose, that they've got that they're not getting pressured, they can get their questions answered, and so there becomes important that whoever the messenger is using the right language and responding to people's concerns.
Let me just get two last quick questions in. One of the other things that I've been interested, we've talked a lot on this show and The Hill, about the connectivity challenge right now, that we've, kind of really moved from an analog world to a digital world because of COVID. Everything's who we love is online, how we work is online, our health care is online with telehealth. And I guess the question is, if you don't have that internet access, you're at a disadvantage compared to others on a lot of fronts. But a lot of people have phones. Are you finding strategies to get to people wherever they are digitally, whether it's on a smartphone or some phone system, as well as high-speed broadband?
I just need to clarify for the record that who I love is IRL in real life. It's not someone. It's not a digital relationship.
Yeah.
So everyone knows my wife. She's a real person. She's three-dimensional, God, we were dating even before.
I was thinking more like
along,
grandkids and grandparents. I just stepped on that one.
I know. But look, got to keep it real. Look, I think there is online and there's online. So for certain populations, younger populations, the more digital, the better. The simpler the experience, the better. For some lower income racial and ethnic minority populations, SMS and texting is actually quite effective. So I think it really depends. And for some people, as you say, they don't have broadband. They may not even have cell phones. And so, you got to be at their church. You got to be in their real life. You've got to be at the places that they go. They may not leave the house except to go to church on Sunday. And so having a mobile van in the parking lot afterwards, and having their church leader talking about, or their faith leader, whatever faith, talking about vaccination and then being there is important. Radio, as we know, with a lot of communities, with the Latinx community, with the Black community, with rural white communities, radio is actually an important link. So those are all really important. And the final thing I'll say about the digital piece is that the other side of the digital piece is misinformation and disinformation. Because getting someone the wrong rumor or a false answer or an unreliable answer to a legitimate question they have because they've gotten that answer on Facebook, that's a problem.
Right.
So the digital platforms, social media platforms, have a job to do here. And I really hope they don't fall behind, as happened with elections and everything else, but that they stay way ahead of making sure that we are not allowing misinformation and disinformation to hurt our ability to get people the answers they need to get them vaccinated.
Let me just ask you finally, one of the things I love the profile you have is you've been in the private sector, you've worked in government, you communicate. And if I were, interviewing you last September or October, and we were honest, there was kind of a law of the jungle out there. So it's not just about trust between the patient or the person getting vaccinated, and whoever the provider of that vaccine is. It's all the other components. It's the companies, the states that were competing against each other, for PPE and for materials out there. I did global interviews where, we were talking about vaccine nationalism, and I'm just wondering whether or not, in not a rah-rah way, has that law of the jungle subsided? Is trust and confidence coming back throughout the system among the science community, the corporate community, the patient community, and internationally?
Well, look, I think trust is slowly earned. I'm buoyed by the fact that people of both parties across the country say they have confidence in the approach that President Biden has taken, but I don't take it for granted either. I think people expect us to be working our butts off. I think people expect us to be honest with them, both for the good and the bad. I think people expect them to expect us to try to underpromise and overdeliver as much as possible, and when we mess up, to say so. I think people hope that we will let the scientists speak for themselves. Not that they will be the only voice, but that their voice will be unencumbered and they'll be able to do their jobs. And all career civil servants across the government can be unleashed. I think they expect us to involve the private sector and make sure that this is all of country response. And so when we do our briefings Monday, Wednesday, and Friday, there's an element of consistency, short, straight answers, honesty, and that I hope shines through, because I think trust is, again, very slowly earned.
Right. And
as you rightly point out, we begin in a trust deficit, and we have a highly divided country. Getting people, and I give great credit to people like Hugh Hewitt and others who have engaged in public dialogue with me and with others about to get out ahead and say, let's not let what happened with masks happen with vaccines. Let's not let vaccines become a symbol of your political identity. You want to have a different political view than your neighbor? Fine. Nothing, you should. That's our country. But there are things that don't have to be part of that identity. And our health, our ability to get back to life, all those things should hopefully be there. So we're trying to do that. Ultimately, we are not the judge of whether we'll do it successfully. The country will tell us based on whether they see us doing what we say we're going to try to do.
Well, I really appreciate the straight talk. I used to interview Senator John McCain a lot, and he used to have the Straight Talk Express. I sort of feel like you're the straight talk guy right now. So Andy Slavitt, right now senior advisor for the White House COVID response team, former acting administrator for the Centers for Medicare and Medicaid Services. When he gets done with this gig and we've solved and saved America essentially with COVID vaccinations, et cetera, he's going to go back. He's got a great podcast, The Bubble, and I look forward to you getting back to that. So Andy, thanks so much for joining us today.
Thank you. Best to everybody.
My next guest is Governor Jim Justice of West Virginia, a state that stands out for its vaccination success rate. West Virginia has deployed its independent pharmacies to administer the vaccines while using the National Guard and state agencies to plan the vaccines movement. Governor Justice, welcome to the Hill, and thank you so much for joining us today. Listen, I'm following your Twitter, and you've got this tweet. I'm going to read it for a minute from yesterday. You say, today I announced that COVID-19 vaccines will now be available to residents ages 50 and above, education workers 40 to 50, and ages 16 plus with certain medical conditions. I have to say, I do a lot of scouring of the country and leaders, and I have not yet seen a tweet from any other leader that's opened up the aperture that much on COVID vac. So what's the secret sauce? And, is this encouraging people to move to West Virginia?
Well, Steve, thank you so much for having me. And people should move to West Virginia. I mean, it is an incredible state. It has 4 unbelievable seasons, and the economics of what we're doing here is terrific. And our state's in great shape, and we're just going to continue to do that. But Steve, at the end of the day, we're a practical, common sense thinking peoples. And to brag about our people are craftsmen, and they're faith based, and they know the difference between right and wrong, and they're just good, sound people. But what really happened here in West Virginia was just this: we identified immediately this was all about age. And with that, we really just got after it. We didn't let vaccines get sitting on the shelf in warehouses while we were trying to devise some program, to be able to try to figure this thing out, some bureaucratic program. I mean, Steve, I say this all the time, but the definition of committee is a collection of individuals that individually cannot accomplish anything, but collectively they can decide nothing can be done. And that's what happened all across our country. And we had vaccines piled up all over the place. But nevertheless, what we did in West Virginia was we got our local pharmacies involved, our local health clinics involved. We got our National Guard really involved, and we got putting people's shots in arms. And really, Steve, it's amazing. But You just think for weeks and weeks and weeks, every single shot that comes into the state of West Virginia, every single one within the week that they get here, we've got them in somebody's arm, and we've done it and done it and done it. So now that they're ramping up, vaccines and the number of vaccines, and J&J is on the way, we're able now to drop our age down to 50, able to really double back and get our teachers that are under the age of 50. We're going to start from 40 to 50. And we got a lot of kids out there that are 16 to 18 years of age that have all kinds of problems and issues and everything that make them more exposed. So we're going to go get them too.
Governor, how are you communicating with your constituents? One of the things we're looking at is trust in communication today. I've spent some time in West Virginia. I just always want to spend more time in West Virginia, but you got a lot of different pockets, a lot of different kinds of communities there. What is the playbook for reaching them? How much of it is digital? How much is it the local doctor? Or, I'm just sort of interested in how you reach your folks.
Well, to be perfectly honest, I had a briefing every single day, 5 days a week. Now we've moved it to Monday, Wednesday, and Fridays. But Steve, I come in front of our people. I answer any question that the press may want to bring up at the end of the briefing. But I go through every single thing. It is completely transparent because you touched on one thing that is everything. That's keeping everybody pulling the rope together. I mean, when you got factions that start out in different ways and everything, it just fragments everything. And I have kept the people of West Virginia all pulling the rope together. And truly, it is an amazing accomplishment for a state that is the third oldest state. We don't have an ocean anywhere to protect us. And in addition to that, we've got all these chronic illnesses and everything. For West Virginia to have been ripe for disaster, to have absolutely led the nation, it's phenomenal. It is phenomenal. And the whole secret is exactly what you just touched on. And that is the very way you message and keep the people together.
One of the things that I've been looking at is this question in some communities of hesitancy about the vaccine, skepticism about the vaccine. I'm just be very honest. One place I would have thought, given political, I would have thought you would have more skepticism in West Virginia. It's turning out to be absolutely the other way around. What's the secret sauce of that? I mean, we're talking about Washington, D.C. Capitol Police. 40% of them, they could be at the front of the line, still haven't gotten vaccinated because there's skepticism there. But you've been able to bring these folks along, and I'm just sort of interested in what can be heard, about what you're doing that might be replicated elsewhere.
Well, first of all, Steve, you got to recognize that I'm a great 350-pound cheerleader. I don't look real great, but I'm good at that. And the other thing is this: I'm good at it because I tell people the truth, and that's my foundation of everything. And I'm going to continue to do just that. Transparency is really, really big, but trust has to be earned, and the people of this state really do trust me, and I'm not going to let them down. So with all that, we still have issues here, just like everywhere else, where people are skeptical about, getting a vaccine. I tell them Monday, Wednesday, and Friday, almost every Monday, Wednesday, and Friday, I said, you have got to get your vaccine. Please, to God above, don't believe these people that are trying to tell you if you take the vaccine, you're going to grow antlers. I mean, you've got to get that out of your system and get it out of your system now, because all the medical experts are telling us exactly what this is. The downside, the number of bad stories around the vaccines are next to nothing. And the bad stories around the situation, if you get this dreaded disease and everything, it's going to eat you up.
Governor, is there a chance to build on what you've done in West Virginia? And I'm just going to be candid. I've talked to other legislators from West Virginia, both senators, et cetera. Opioid crisis has been high and reaching people during a time of real stress out there from this pandemic. Is there an opportunity now to take the success you've had in communicating with your public, moving them on the right health care track, and looking at how you build on that in things that aren't related to COVID now?
Steve, I absolutely believe that with all in me. West Virginia's total image has really transformed into a different type of image today. Now the whole world is looking at West Virginia saying, dag, is that the diamond in the rough that we missed? And with all of that, whether it be, all the drug issues, whether it be, just the sheer, education issues or the sheer idea of keeping the economics running in the right direction. West Virginia right now, believe it or not, Steve, is right on the cusp of doing away with our personal income tax in this state and being the most northerly and easterly state in the nation that is close to that population that won't have an income tax. There is so much good happening in West Virginia today. It's unbelievable. And the myth that, West Virginia is behind or backward or whatever it may be is just a myth. We've got really smart folks here that have done a lot of good stuff, and their morals are so well-based and everything that they're just good people.
Well, I got to tell you, we're taking questions from the audience, but I'll just tell you before I bring on Jennifer here in a moment, one of the things that really blew me away is you get 100%, as you just said, 100% vaccination rate with the vaccines you're receiving. And I don't think that's matched by anywhere else in the country, not at 100%. So there's something pretty remarkable there. And I just want folks to understand that is not an easy thing to accomplish. We have a question for you from Jennifer. Jennifer?
How are Mayor Garcetti and Governor Justice disseminating fact-based messages to their populations? Have they launched mobile campaigns? And what about for those with inconsistent or no internet access at all? How will they be educated? Thank you.
Great. And that was Jennifer Gerber. Jennifer. Governor?
Jennifer, I want to answer your question, but Steve, you've got to repeat her question for me because I couldn't quite hear her question.
She was asking how you are disseminating fact-based messaging, how you're launching mobile campaigns, perhaps, how are you reaching a community? So I think one of the points of tension out there are fact-based campaigns and how governors like yourself are communicating them and how you're dealing with disinformation. Well,
first and foremost, Jennifer, thank you again for the question and everything. Let me just say just this. It always falls back on this. Is the governor a politician, or is he really telling us straight stuff? And is the mission that is happening all around him? Is his leadership team? Are they advised, or are they fragmented? My leadership team constantly knows what the left arm and the right arm are doing, and absolutely I know what they're doing all the time. With all that, all the messaging goes out into, if you talk about a place that could have been really tough to get the messaging out, it should have been West Virginia. But again, the reason that we stay just the way we stay is because we all know what each other's doing, and we all just continue to work it in as favorable way as we possibly can all the time.
Governor, I just want to ask you finally, we have had an inflection point in presidential administrations. I was talking to Andy Slavitt a little bit earlier on kind of what's going well, what hasn't gone well. From a health perspective, from a COVID perspective, have you noticed any changes that have mattered on your dashboard in moving from the Trump administration to the Biden administration? Well, Steve, let me say this. We want to be super respectful to the Biden administration because, President Biden is our president, and we're going to be super respectful. But at the same time, we want to be thankful, too, for what President Trump and his administration did as well. Let's be fair. When they took over and everything, when this thing hit them, no playbook, and they went from scratch. Now, when they passed the baton on to President Biden and everything, he has taken off with it and taken off with it very favorably as well. So we give lots of kudos to both. And at the end of the day, this is tough stuff. That's all there is to it. Pushing the right button at the right time was always really tough. And a lot of tough decisions and a lot of prayers. But we give both of them real kudos here. Well, Governor Jim Justice of West Virginia, I love your state. Thank you so much for joining us. I hope you'll come back. I loved having this conversation with you. Listen, I'll come back anytime, Steve. Thank you so much for all you do every day. Thank you, Governor. And now it's time for the sponsor perspective portion of the program. While I'm conducting the interview and the questions are mine, this part of the program shouldn't be considered editorial. With that, it's my real pleasure to welcome Reform Alliance board member, Dream Corps founder, and CNN host Van Jones, and Mark Hines, CEO of Granicus, a software company that blends software and communications to help federal, state, and local governments engage with citizens. Mark and Van, great to be with you to talk about these important issues. As I look over, my shoulder and I see that shot, I have sort of a needle phobia that I'm still trying to get over. But I know, Mark, you and your company are out there communicating to people like me who might have a little, suspicion about this. Tell us what is in the most important parts of trying to reach the communities today that are hard to reach. We're not talking to people that want to line up immediately. We're talking to people who are not trying to get out there. How does Granicus, how does the platform you do help address reaching those folks that have not been first in line?
Yeah, thanks, Steve. No, I think that is by far the most important question because, as you pointed out, I think, it's not the first in line that we need to worry about. It's the folks that have, in most cases, real reasons to be hesitant about the vaccine. And I'd say that, Granicus, we're a technology and digital communication provider for about 4,500 government agencies, federal, state, and local. And they're using a platform that basically supports about 50,000 government communicators, send digital messaging like emails, SMS messaging, social media posts to help change the narrative, really, to help, break down some of these issues of mistrust that are, in essence, generating significant hesitancy around the vaccine. And that's incredibly important because I think it's really important to frame, the question. And the question is, how do we get to herd immunity? That seems to be the bogey everybody's targeting. And if you can't address those populations, particularly those that have been, marginalized during, the COVID and pre-COVID crisis, we're going to have a really hard time getting to past vaccine hesitancy to a point of herd immunity. And it's our view that if, through the use of digital communications and broad communications, that, modifying that narrative really is the way to try to change the tenor and the narrative associated with vaccine hesitancy.
Van, one of the things I've been thinking about as we, talked about this is how do we reach into these communities that sometimes, may not be on the same, may not be watching this Hill broadcast, right? They may be, in a different quadrant of communications. And so as you hear sort of Mark talk about email, SMSs, and reaching, from your experience of reaching out to communities, which, I know you just did in this incredible day of empathy, what are the tricks of the trade that you think would be helpful in our reaching communities that previously been marginalized, have not been at the forefront of our health system?
Well, everything that Mark said is a key component in that you have to influence the influencers, and the influencers often are quite sophisticated. They're pastors, they're people who run youth programs, they're store owners, they're entrepreneurs. And the question is, can you get those influencers, bought in? We often talk about Black Lives Matter, and that's they very much do. Math matters as well. The math here is pretty shocking. African Americans and Latinos 3 times more likely to be hospitalized than our white counterparts, and twice as likely to die. I'm gonna say it again: same virus, 3 times more likely to be hospitalized, twice as likely to die if you're Black or Latino, for a variety of reasons, which include we're often the essential workers on the front lines. There's been public health epidemics around, diabetes and asthma and hypertension in our communities for decades. Public health system not working well in some of our communities. It goes on and on. And yet, less than half of African Americans, when polled, say they are ready to take the vaccine. Now, those two numbers should get everyone's attention. When you have a community that is 3 times more likely to be hospitalized, twice likely to die, and only half or less than half say they're willing to take the vaccine, you have a public health emergency that's also a public communication and confidence and trust emergency. And you've got to move in aggressively. It's one of the reasons I love Mark and other companies that are trying to use technology as a force multiplier behind the people who understand, how desperate this situation is. People need to hear from trusted members of their community that they have themselves been vaccinated, that they didn't have negative effects, and they did it because they care about their family and their neighbors and their kids and their moms and their dads and their communities. That's the message. I did it. Here I am. I'm breathing. I'm fine. And I did it because I care about my community. But that's got to be force multiplied by smart technology and smart approaches.
Yeah,
Right.
I couldn't agree more. And it's interesting that you said that during the COVID disease, or we're still during it, but 2 to 3 times more likely to be hospitalized or to die. We're actually kind of recurring the same mistakes during the vaccination, right? So I mean, it's early on, but already we are vaccinating 2 to 3 times more white and wealthy communities as we are underserved communities, right? And so this rush, in which we all understand the rush, right? 100 million doses or 100 million vaccinations in 100 days. Is a great goal, but it's only partial goal. And it would be, I think, a real shame to declare victory after 100 days if 100 million vaccinations were administered, yet they were administered at 2 to 3 times, in white and wealthy communities as underprivileged communities. So to your point, Van, we got to change the narrative. We really have to think about setting the goalposts differently and not just volume, but whose arms they're going into, and particularly addressing those that have had the largest impact during the course of the disease.
Mark, I now know you and Granicus know a little bit of the history of your platforms and all this. Has there been a project or an effort in communications before that gave you lessons in scale and reach to communities that needed this same kind of push, that there were some problematic dimensions of reaching communities? Tell us where you learned how to kind of move this communications agenda forward.
Yeah, no, thanks, Steve. So what's really, I think, cool about using digital technologies, in today's moment, is it's able to target, hyper audiences, right? And Van talked about this. This is no longer kind of in the time of COVID where you're just blasting kind of singular messages, one size fits all, wear a mask, social distance. The problem of vaccination hesitancies and overcoming hesitancies now becomes a nuanced one. We have to speak to very specific issues that are driving hesitancies in Black communities and Hispanic communities and generally people of color. And so a similar project is an example that Granicus worked on. We had the good fortune of working, on the 2020 census project, which has a lot of similarities, right? I mean, there was a great deal of mistrust by many, people of color communities with government entities knocking on their door and why they were trying to take a census. And in the COVID, you couldn't even knock on the door. So we partnered with the state of Minnesota as they were trying to increase their, basically count of underserved communities so that they could get their fair share of federal resources. And they used a digital platform, the Granicus Gov Delivery text and SMS platform, to send out 1.4 million messages, SMS messages to particularly communities of color, reminding them and explaining to them why it was important, to sign up for the census and what it meant in terms of funding for their community. And just that one initiative alone, I think increased their uptake by about 2 points, which seems like a low amount, but it took them from 73% to 75% registration rate, which is the highest in the country. So Minnesota landed the census with the highest self-registration rate in the country, largely due to their broad communication initiative to communities of color.
Van, I know that part of the secret sauce, if I may say so, of your work is bringing odd bedfellows together, of bringing folks that wouldn't otherwise be hanging out at the same bar, being out there, walking the same walk, and you've got this knack for doing that. I'm wondering, as you look at this question of communicating with folks that are skeptical. I was on a call this week with April Ryan with very senior administration officials, and she asked them about race and blackness. She is not just, the citizens out there, that there are a lot of Black health professionals that are skeptical of this. And I'm just interested, you crash through these biases that folks have sometimes. And I'm just wondering, is there any of that that's relevant to this question of trust in communication and really trust building when it comes to the vaccination challenge we have?
Acknowledging a difference, acknowledging where the battlegrounds are is really key to figuring out where the common ground is. We have had different experiences with this public health system. The people, if you're an African American, you know all about the so-called Tuskegee experiment. It's a real thing. where African Americans were used as guinea pigs, human beings, given syphilis and allowed for syphilis to go untreated for decades. So people were sick, were infecting people, and thought they were getting health care and were not. One of the first lawsuits I ever filed or helped to litigate when I was a law student was against the NHS not doing enough informed consent with Native Americans on vaccines. So you have had a very bad history. You've got to acknowledge that. If you don't acknowledge that people's reasons for concern are real, they're historically grounded, they have to do with people's daily experience getting mistreated. You go to the doctor's office, you don't get the same treatment, you see somebody else getting better treatment. You've got to acknowledge all of that. And then I think you have enough trust to then pivot to this particular vaccine and the particular emergency and the vulnerability that we have. And then I think you can move forward. But when we did the stuff with criminal justice reform, we had to acknowledge that the political parties had different interests in moving this forward. For some, it was more financial. For some, it was more about civil liberties. Some, it was racial justice. Some, it was social justice. Some, it was about their Christian beliefs or their religious beliefs. Fine. Now we all understand each other. What can we do together? That's got to be the approach. We don't have the same experience, but we do have the same emergency. How can we work together?
Right.
Yeah, 100% agree. One of the things, the benefits of kind of using digital technologies, you get to measure everything, right, in terms of results. And one of the things we said completely, validates Van's hypothesis, right, is the messenger matters, right? So, federal government is, kind of has its lowest trust rating in a very long time right now, and even particularly in the health community for the reasons that Van articulated. But as you move kind of closer to local community leaders, that trust factor builds, right? And, the highest trust factors from messengers come from community leaders, religious leaders, local government leaders. Those are the folks that actually have the highest trust ratings right now. And digital communications and communications in general about addressing the very specific hesitancy concerns of specific populations from that group get by far the biggest, uptake. Right. So, in our view, it's about the federal government and state governments activating and mobilizing this network of 50,000 publishers and communicators closest to local communities that can speak with the voices of those communities and tell the stories that will get traction in those communities about the concerns that they have. As an example, right, even Black and brown communities have very different hesitancy views. We kind of collectively talk about it as hesitancy. But if you look at the polling of the Hispanic community, the primary concerns are about, am I going to get a bill for this vaccination that I can't pay? And, is my immigration status at risk? So this is contributing to over 20% of the hesitancy in the Hispanic community. These are issues that with broad-based campaigns from trusted leaders and trusted voices that address those specific issues could increase the vaccination, interest by 20 points in the Hispanic community alone, which are very different from the Black community and other communities that are hesitant.
In the last 2 minutes we have, let me just ask you each just for quick slices of this. And this has been a great conversation, but I'm interested, look, we don't have a choice, right? We have to get everyone under the tent. We have to go to where people are. And I know, Mark, that is the goal that Granicus has. Van has that. I'm just interested in the next time. I'm interested in, is there a process here where we're building capacity, we're building knowledge, we're building data, and somehow going to have some resilience in our ability to reach these communities again, so that we don't have to go back again and remake this and pretend, wow, there are marginalized communities. Is there any dimension in this discussion that we can have confidence is about building, not just for now, but for the future? Mark?
Yeah, it's a huge point, and it's one of those you never really want a good crisis to go to waste kind of moments, right? Is we have an opportunity as a nation and as a collection of government agencies and public officials to kind of bridge this digital divide and create a communication and human connection between our public officials and our citizens. And so literally, we are working with, for example, the state of Virginia, among other states, and the Department of Veteran Affairs, for example, to go and make sure that we're getting, a digital connection, get an email address, get the telephone number, so that we can, in this moment of urgency, communicate in a dynamic and measurable way to make sure we're getting to an outcome. Well, once you have that email address, once you have that phone number, we are now armed with these, liquid and, vibrant channels to be able to use for the next crisis that is certain to come. And when you when you know that these are truth channels, that these are direct communication channels from trusted officials and trusted voices, the next one, you're now able to leverage that same, set of campaigns and that same set of channels for truth telling in a way that is now more trusted. So 100%.
Van, let me give you the last word.
I agree with that 100%. When you think about the Dream Corps, which I'm a part of, we have our Day of Empathy. It's not just a day of empathy. There's a whole network of people that we've built up over 5 years. That once a year, we do a national day of action together. We did it this week. It was an amazing experience. 40 states, mostly virtual this time. But that's a network that we invest in every week. We send an email, so that it's standing infrastructure. You've got to understand that public health now in this age of distrust and disinformation, you can't just rely on the government website. You've got to build up community capacity to communicate with itself about itself, and that is a different challenge. And you need technology like the kind of stuff that Mark talks about. You need community organizers like we have at the Dream Corps, people like Lewis Reed and others who have a national network literally in their back pocket. Those now have to be considered critical public health infrastructure, not just grassroots organizers.
Well, Mark Hines, CEO of Grainicus, Van Jones, Reform Alliance board member, founder of Dream Corps, of course, and we all know him from CNN. And really, congratulations on the Day of Empathy. I want to thank you both for this important discussion. And Mark, thanks so much for supporting today's conversations.
Yeah, thanks for organizing, Stan. Thank you very much, Van, for joining.
Thank you.
And now it's time for a real powerhouse panel. Lisa Sherman is the president and CEO of the Ad Council. They recently launched their own COVID-19 vaccine education initiative. She's got a great Twitter feed. I'm already following it and addicted to it, so thank you for that. Mayra Alvarez is president of the Children's Partnership, a nonprofit advocacy organization working to advance child health equity. Mayra is also a newly named member of the Biden-Harris COVID-19 Health Equity Task Force. That's a mouthful. Dr. Alicio Perez Esteble is the director of the National Institute on Minority Health and Health Disparities at NIH, and Dr. Giselle Corby-Smith is distinguished professor and director of the University of North Carolina's Center for Health Equity Research. Folks, if we can't solve this problem today amongst the four of you, then I don't know what's going to go on, because each one of you sits in a corner. We have the Ad Council, we have medical doctors, we have experts on health equity across generations and across other divides in society. So I really appreciate all of you joining us. Dr. Perez-Esteble, let me start with you. I've interviewed many of your colleagues, doctors, others at NIH and during the previous administration, and I kept asking them about what's the communications plan. Are you going to reach into Native American communities, Black communities, Hispanic communities, by the way, all of which are not the same? I mean, you kind of go around and you kind of look at the diversity of the fabric of this country, and the kind of it requires some support. And everybody said, "Don't worry, we've got it taken care of. We got a communications plan." So I guess my question to you, because you've been out there saying we not need only you had a great line. That messages should not just demonstrate cultural awareness, but cultural humility. And I'd love to kind of get your sense on whether we got the rollout and communications right, whether it's still in progress and we need to do more. Let's start with you, and then we'll move around. You're on mute, Doctor.
Hey, I'm sorry. I would say that the communications plan from the very beginning was there, but it is a work in progress all the time, because we learn as we do this. And you're absolutely right. The community is very diverse. We have to adapt and tailor the messages depending on the population, the geography, the age, where people are coming from. And so I think this is critical. The most important point, though, is that we need to develop trust and build trust in the science, in the evidence that we have as scientists and as a public health infrastructure. And the messengers delivering that message need to also be trusted by the community. It doesn't have to be Dr. Fauci all the time, because he just can't do it. It doesn't have to be the faith-based organizations only. It doesn't have to be a celebrity. It actually, a very effective messenger is your local doctor, nurse, or other health worker who can relate to the community they work with. So we're working on it. I think all of us are pulling in the same direction, and I'm very pleased with the progress we've made since beginning of last summer.
Well, I'm glad to hear that. I mean, Dr. Corby Smith, let me ask you. The other day, I sat down in a heartbreaking Zoom call with people talking about some of the inequities in America's healthcare system. Talking about maternal mortality and the racial divides there, talking about chronic diseases and the racial divides there. And I just walked away and I just said, holy crap, this is just something that is outrageous in many ways. And now when you throw a pandemic on it, we've seen how the pandemic has hit communities differently, has hit the Black community. Right now, I'm going to be talking to Mayor Garcetti in a moment from Los Angeles. The Hispanic community is now dying at the highest rate among different groups in Los Angeles. But I guess, there's one way to kind of look at the history of this, which I'd love to get a snapshot from you on. There's another way to sort of say, can this be fixed? I mean, in the pandemic, can we rewire the social contract in a way that's fairer and better than it is today?
Well, I appreciate that comment. And in terms of the prior panelists, I think I would endorse the idea that you can't let a good crisis go to waste. And so we have seen the fault lines between our public health system and our medical and our healthcare system in the setting of this pandemic early on, the important guidance that we were given around staying at home and what this has meant for communities of color, particularly Black and Brown communities, what it's meant in terms of the economic impact, and we're only beginning to understand the health impact. In the first 6 months of the pandemic, based on data that we have, we know that life expectancy has decreased for Black and Hispanic or Latinx populations more than the white population. It's gone down overall, which to me is in and of itself remarkable. But Black populations has had almost a 3-year decline in life expectancy. Latino populations or Hispanic populations, almost a 2-year decline, and whites almost a 1-year decline in life expectancy. And that's in the first 6 months of the pandemic. This is a crisis that really has revealed for many that aren't typically in this space, like our panelists are, that health inequalities are long enduring and entrenched. And if we're not careful in this moment in time to really capture and take advantage of the way that we need to rework our healthcare system, and our public health system will be back in the same place in a couple of years.
Before I jump to Mayra and get this, and then I'm going to ask Lisa just to figure out what the course is to reach everybody. But I want to ask Dr. Corby Smith, when you think about what ought to be some of the essential pieces of communications plans, what to reach these communities, to get them where they are, what are some of the things that are high on your list?
Well, as Eliseo pointed out, this is about building trust, and I would even go so far as demonstrating the trustworthiness of our healthcare and our public health system and our scientific and medical community. The onus needs to be placed on us that are in that space to demonstrate our trustworthiness. We also, there's been a tremendous amount of work that has taken place over this last year that have pulled together communities that have tried to bridge that divide between public health and our healthcare system. And we need to look at those pieces and to see what we can do to make sure that they're in place after this pandemic. How can we build and extend the workforce that has grown up around this pandemic, our community health workers that are typically straddling all of these elements of our communities, of our healthcare system and public health, a vital force that has been fully recognized in the midst of this pandemic. What do we understand about effective communication, whether it's in the setting of misinformation or accurate information, depending on your flavor and what you see as true or not true? But we do know about what gets to people and what people pick up, right? And so how do we use that information to ensure that everyone has the information they need to make an informed choice, whether it's about COVID-19, vaccines, or the treatment of hypertension in the future?
Thank you for that. Mayra, I think I have been on every phone call with so-called senior administration officials of the Biden-Harris administration since they've come in, that they, talk to media. I make time to make sure that I'm on all of them. And I do get a sense of the urgency. They always talk about equity. They talk about both, how we reach in different communities. But, I know that you span a couple of roles. You're both an advisor, but you also worry about children. You're, children of Mexican immigrants who've come in this country. So you've got a lot of perspective in this space. And I guess I would ask you, in a polite way, what are the blind spots in conversations of this that you think we should be aware of and that we need to fix in being serious about plugging some of these holes as we build trust and communicate around COVID vaccine?
Sure, definitely. And first, in a polite way, it's Myra. Just want to clarify.
I'm sorry, Myra.
Myra.
Yeah, thank you.
No problem. No problem. So I think first and foremost, I want to emphasize that those of the communities that are hardest hit are also the same communities that are on the front line keeping our economy open. So it's folks that are working the tough jobs, taking care of those of us that have the privilege to work from home. And so many times they don't have the luxury of time. And for many of our sites that are based in the community, bringing care to where they are, it's incredibly important. But we also need to be flexible and ensuring that there is a huge gap when we know many of those families are working. So an example that we applaud is both East LA and Oakland here in California, working with the administration, opened up vaccination sites. That's tremendous. Again, bringing care to the community. But here in San Diego County, we were able to open up vaccination sites and have walk-up clinics, right? Walk-up sites so that families don't have to wait for a certain window of time, but go on their own availability. In addition, building on what Dr. Perez-Estable said and Dr. Corby Smith is really thinking through who are those trusted people. We know community health centers, promotoras, community health workers, they have that trust and they can actually be proactive in reaching out to populations, not waiting for people to come to them, but being proactive and reaching out by phone, seeking them to come in and get the vaccination. I think that specific intentional efforts to reach our communities is necessary and something that we want to ensure we do. And to the point of Dr. Corby Smith, making sure that we're not placing the responsibility only on communities of color, but recognizing that there are historical structural barriers to care for many communities of color. They have less access to healthcare, less access to transportation, less access to safe communities. And it is a result of those inequities that COVID is hitting these populations so hard. So we have to have a recognition that it's not only the responsibility of communities of color to actively engage in this process, but for our systems to better serve them as well.
Myra, I really appreciate that perspective. And I'm going to jump to Lisa in a second, but I want to ask you one more second. Myra, and I apologize about mispronouncing your name. But, I this need to be careful here, but I was in a drugstore in Maryland the other day that was dispensing the vaccine and happened to hear a conversation between an elderly black gentleman, probably 70s or 80s, and trying to tell the person working there that they had been trying over and over and over again every day for many, many weeks to get an appointment. And I could tell that they were not connecting. So I told the gentleman that he could go online, and usually around 7:30 in the morning, there were a lot of appointments. He said, look, I don't have a computer. I'm calling the phone number. And he was talking about his phone, and he was reaching out. And I wanted to say to this young intern, take this guy. This guy's here and wanted to show up, has been trying to do it. Is there as we're all pretending to be sensitive, as we're trying to look at reaching people where they are at scale, is there an insensitivity that we need to figure out in this? Because I was fairly upset when I saw this happen. But I realize it's a boutique, maybe hopefully anomalous moment, but it made me very frustrated when I saw that happen.
I think there is a misunderstanding of what many of us have access to and take for granted, right? Whether it's broadband access or being able to wait on the phone and expect to come up with an appointment. Not all of our families have, like I said earlier, the luxury of time. So knowing that is the reality, what can we do to address that barrier? Again, having these walk-up clinic sites, having folks that know these patients, that have a relationship with the community clinic, reach out themselves, recognizing the power of our community leaders and promotoras and community health workers that have that trust. Those are intentional efforts that will help address these this just lack of equity when it comes to our everyday lives. And if we recognize that, if we start there, if we start with our most marginalized communities and the limitations that they may be facing, we can make sure to have more equitable distribution of the vaccine and really get the virus under control.
Well, thank you. Well, Lisa Sherman, now as we kind of look, we've heard from our friends at NIH, our friends looking at diversity, our friends looking at other divides. I know that the Ad Council has been working on education initiatives, working with the Latinx communities, working with the Black community on with a campaign called "It's Up to You." I'd be interested in what this is the wrong way to frame it. What are the tricks of the trade for succeeding in communications that our colleagues here and those watching online ought to be aware of?
Well, thanks for the question. Obviously, this is the biggest public health issue of our lifetime. So we just launched the most significant public education effort in our history, along with our partners at the COVID Collaborative. And we have this unprecedented challenge, right? We're trying to get probably 250 million people to take a specific action. And the way we do everything is we ground everything we do in facts and research. And if you look at the data, and you remove the folks that have already gotten vaccinated, those that say they're going to get one once it's their turn, and those at the other end of the spectrum that say they're probably never going to get one, they're about 40% of the people in this country who are really, we see them as the opportunity. They're taking a wait and see attitude. They're still undecided. They're looking for real world evidence and assessing the risk benefit analysis for themselves. And I think that just underscores the need to get them educated on their journey. And that's really the approach we're taking. And as we begin to understand the hesitant mindset, we know that trust is at the core. We've heard that in this panel with my colleagues here, as well as the previous panel. And it's complicated and it's very nuanced. And so we understand that this is not a one size fits all proposition, that we really need to have a common messaging platform, but we are looking at multiple distinct campaigns to reach specific audiences. And we've got specific strategies in place to reach the Black and Hispanic communities, as well as the white, conservative, rural populations as well, where we also see hesitancy. And the common thread, it's like a three-pronged approach we're taking. Number one, we have strategic media that can reach those audiences. Number two, so that allows us to go broad, but then we're going deep. And we know, and we've heard this over and over, we have to be in communities with people at the grassroots level, partnering with community-based organizations, faith-based organizations, who are those trusted messengers. So from our perspective, we're working with everyone from the NBA and MLB to NASCAR and WWE. It's a very big tent. We're looking at working with influential faith leaders, really prominent folks in the Black and Hispanic community. And we're also engaging with conservative evangelical faith leaders, because that's how broadly we have to approach this. And so that's the tack that we're taking.
I want to ask I want to get a question in from our audience for you, and we're a little short on time, which I apologize because I love this conversation. But Dr. Perez-Estable and Dr. Corby Smith, one of the, and all of you really, one of the things that sort of haunts me about this moment is whether or not we actually do things right. We do figure out a way to reach into communities. We do move the needle in ways we hadn't before. That it all disappears and that, something else happens down the road. So, Dr. Perez, I would ask you, when it comes to things like clinical trials and reaching communities that we've always heard, in the research part of this, we have replicated essentially, some of the same divides and divisions that we're talking about today. And so I would just like to ask all of you real quickly, do you think that this experience and that the lessons we're learning about reaching is going to become institutionalized? Are there things we need to do to make sure that it's institutionalized and built so that we are, connecting in serious ways down the road if we do get this right? I mean, I live in Washington, D.C., and, it's not, institutional memory here is not great. So, Dr. Perez-Estable?
I live in Washington, D.C. as well.
Well, institutional memory is good at NIH, but nowhere else.
Yeah, the message and the experience we're witnessing now didn't come out of thin air.
Yeah.
This is the product of work that scientists and public health advocates and community organizers have been doing for the last 30, 40 years. That's been part of my entire career, and Dr. Corby Smith's as well as many others. And so I think that this opportunity, this crisis, created an opportunity for us to implement these. And to Dr. Collins's credit, he saw that opportunity and he invested significant resources that Congress had allocated to NIH to do testing. And so we were able to set up this community engaged network to do more testing. After that, we set up this community engaged alliance against COVID to deliver the message and to get the trusted messengers out there and to partner with organizations like the Ad Council and all of these community organizations. So my vision on this as an institute director is that this is not the end once the COVID pandemic is managed or controlled, but we are actually moving in a new direction to set up an infrastructure that will be able to address our chronic pandemics, from diabetes to structural racism and discrimination to substance use, all the things that we've been dealing with and addressing for the last couple of decades. So that's my short answer.
I really appreciate you giving that context, because I think a lot of us don't know that. It's really kind of heartening to hear that. Dr. Corby Smith?
Yeah, so I would just pick up where Eliseo just ended, which is, I think, for us to take advantage of this moment to ensure that everyone has an opportunity to live a healthy life, we need to be clear-eyed in what got us here, that this is not just a virus. The virus revealed policies, practices, and norms that have led to inequalities in health and healthcare for as long as we've been collecting those data. This is not a new problem. This is an issue that was revealed by the virus. And similarly, the vaccine deliberation that we're seeing in communities, and I prefer that term over hesitancy, is exactly what Lisa has described, is that people are watching and waiting. In Black and Brown communities, BIPOC communities, we're waiting to see, is this system really going to right itself? After years and decades and centuries of demonstrating that the lives of Black and Brown people were not valued in the same way, what is going to be different this time? And that underlines so much of the deliberation that I see in my patients. For that, some people, it's going to be a slow yes to get to vaccines. They're waiting and watching, and so grateful for Lisa's work through the ad campaign, the Ad Council, to be able to offer accurate information so people can make an informed choice.
Great. I also appreciate that context. Myra, Lisa, quick thoughts? Myra?
Well, I'll just say, go ahead, Myra. I'm sorry.
No, go ahead, please.
No, our focus at the Ad Council is to take on the big issues facing the country, and we focus on a lot of health-related issues. And I could not agree more that the systemic health inequities rear their heads across every one of those topics. And the infrastructure that we're putting in place for what I'm calling the air game, the broad reach of the Ad Council, and now coupled with what I like to call the ground game, where we're reaching into communities through partnerships and coalitions, has to be part of how we're going to attack these issues going forward, for sure.
Great, thank you. Before we take a question, Myra?
And the only thing I will add is that the crisis that we're facing right now, it's really a convergence of crisis. It's the pandemic, it's a struggling economy for families, it's ongoing racial injustice. And when we saw protests, for example, across the summer because of the murder of Black men and women, it was calls for justice. And it's those same communities that are looking for calls for justice when it comes to their health and their well-being. And the pandemic has laid bare the inequities, and there's no turning back from that. And I think all of us remain hopeful that together we can address structural racism, we can address the barriers to care that so many of our communities have faced for centuries, and we can make a difference and provide health and well-being for many more Americans.
Well, thank you for that. We have a question from Wilson, Washington. Dr. Wilson, Washington.
Hi, my name is Dr. Wilson, Washington. I'm the Director of Health and Human Services for the City of Atlantic City, New Jersey. And I have a question. My question is, what is the number one reason why people in community of color may experience vaccine hesitancy?
Good question. Dr. Perez-Estable?
Yeah, no, I think there's a lot of misinformation that has been disseminated about this is a conspiracy. You're going to get the virus. They're injecting a chip. It comes from multiple sources. And I think that the public health community and scientists were a little slow in reacting to addressing this misinformation. And we kind of thought, well, the data will shine through. Well, guess what? We can't rely on that. We have to be proactive in promoting the trusted messages. The problem is exacerbated in the African-American community because of the historical inequities. And again, reiterating what I think Maida said earlier, we have to acknowledge history and move forward. We cannot ignore that and say, oh, everything's okay now. No, that's not the message. We have to acknowledge the past and move forward.
Just quickly, let's get everyone. Dr. Corby Smith, Myra, Lisa?
Yeah, I wish I could give you one reason. I think Eliseo very eloquently points out the need to acknowledge history. And while there is a clear history that's already been acknowledged for Black communities, Indigenous communities, Latino communities, Asian communities in this country, and Asian communities now are experiencing disproportionately racism and discrimination because of some of the political rhetoric around this pandemic. I think that history, plus the way the everyday experiences of people in and with the healthcare system, are part of the reasons that undergird this lack of willing to entrust their lives, frankly, to a healthcare system that's demonstrated that it hasn't really valued their life.
Thank you, Lisa.
I would
Sherman?
just add that based on our research, I would just underscore the distrust in political and economic motives of the government and corporations. And then just some basic things like people just have concerns about the safety and side effects, the speed of the clinical development process. And then, of course, we know that there are these established and novel conspiracy theories that live out in the world. So it's really a combination of all of those things.
Myra? And I would just add that it isn't one quick answer that we can provide, right? It has to be multi-pronged solution. And I think falling back to believing that it is one quick fix is going to lead us nowhere. And recognizing that we have to have multiple efforts to address this, recognizing historical discrimination, recognizing the real structural barriers that continue to exist in these communities, and working together to rectify that.
I would love to have this conversation, like every 3 months and just, take the temperature of where things are. I learned a lot from all of you. I learned, one, that there's been more going on in the messaging and thought, than I had been aware of. But I'm also aware that you can go to Greater Baltimore and you can go across a zip code line and there's 20 years difference in life expectancy. And so I think this curve between, what we need to do by way of messaging, for those communities, but at the same time, making other people realize, in fact, there are these disparities that have to be fixed. I really, really appreciate the candor and honesty that all of you have brought to this. Lisa Sherman, President and CEO of the Ad Council, Myra Alvarez, President of the Children's Partnership and a member of the Biden-Harris COVID-19 Health Equity Task Force, Eliseo Perez-Estable, Director of the National Institute on Minority Health and Health Disparities at the National Institutes of Health, which I love. NIH interviewed Francis Collins, many other folks that are just doing great work, and Giselle Corby Smith, Director of the University of North Carolina Center for Health Equity Research and Kennan Distinguished Professor of Social Medicine at UNC. Thank you all for joining me today and for sharing your important work and thinking.
Thank you. It was great.
Yeah. Thank you. Yeah, and we'll come back in 3 months.
Excellent. Joining us now is Mayor Eric Garcetti of Los Angeles, one of the hardest hit cities during this pandemic. Things are looking up these days as both cases and deaths are now on the steep decline. I'm looking forward to hearing from the mayor about the rollout of the vaccine, its equitable distribution, and the road ahead. Mayor Garcetti, it's so great to see you again. Let me just ask you, we're sitting at a time where, I know Los Angeles well, and you have been a mayor very, very committed to reaching the parts of Los Angeles that aren't always at the front of the line when it comes to health outcomes. What are you doing? What's your dashboard look like as you look at the city and as you look at what we're dealing right now with what's still a scarce resource, which is the COVID vaccine?
Well, you're right. It's great to be with you, first of all, Steve, and thank you. Good to be back with you and to talk about this stuff because, for me, from the beginning of this as a mayor, I always used an equity lens to look at how this disease, while it didn't discriminate who it infected, it certainly discriminates how it infects you because of long-standing health disparities. So when we saw, for instance, early African-American deaths in our country be double the represented population in major cities, we in Los Angeles surged testing, messaging, community support in African-American neighborhoods. And we saw that drop down, that if you take that first month away, deaths in the African-American community have actually been lower than the represented population. And we're taking that same knowledge to work in immigrant communities, the Latino community, to look at low income and high density communities to bring equity to vaccine distribution. Because if you just put out codes and you just put out information that you can log on with a laptop or a desktop online, those vaccines will always go to the higher education, higher income, less dense, and often less communities of color areas of a city. The early statistics for our county here in LA County showed, for instance, 3.5% of vaccines were going to African Americans, with nearly 10% of the population being Black. Similarly, half the population is Latino, only 23% of those vaccines were going there. So we worked with the county and my firefighters and community-based organizations to take mobile teams into the community. And we've seen, for instance, those mobile teams do 90% people of color vaccines in Black, Latino areas. And it's really the 4 T's, I say. You need to tell the truth to folks. You need trust, trusted messengers, community groups, and clinics that people already know. Then you need the technology and the transportation that really speaks to people who are lower income. Not everybody has a laptop or a desktop, but they do have a mobile phone. Code it and make it easier, especially for those who are technologically challenged or don't have the broadband connection. And then transportation is critical. These mega sites like Dodger Stadium, we stood up the biggest vaccine site in the world at Dodger Stadium, but we need to make sure people get rides there, whether they have a disability, low income. And so we've pooled together our local MTA, Uber, Lyft, Access, which is our paratransit for folks with disabilities. And we're putting together an app that people can just say, need a ride, boom, you can go.
Is that, Mayor, part of the MOVE project, this mobile, I call it the Mobile Outreach for Vaccine Equity Initiative? I mean, maybe you just described it, but I think it sounds cool. So could you double down on that and tell us a little more?
So MOVE is our program to not just have these big sites, not just the pharmacies or your medical provider, but to actually take a mobile site that can set up in, a parking lot in a high density, low income area of our city. And we walk door to door, we work with trusted community groups, give tickets out, and make sure that people from those communities, not people driving across town, are getting those vaccines. We started one in South Los Angeles. 77% of those were given to Black Angelenos, over 90% to people of color. Then we moved to another one in South LA, the east side of our city, which is the heavily Latino heartland, our San Fernando Valley. And we're gonna have 10 of these, the equivalent really of a mega site, but on wheels. And we'll come back, 3 or 4 weeks later for your second dose. And this is really showing a model that we shared with the White House, other mayors. And I've talked to mayors like Mayor Durkin up in Seattle that's doing the same thing. And the national, mega sites that are being put together by FEMA and the Department of Defense now include also mobile teams so that people who can't get to the mega sites can have those vaccines come to a parking lot corner near them.
One of the things, this is a little off script perhaps, I love Mayor Durkin in Seattle, and you're all struggling with how to do good for a lot of people. But there are some people out there that are suspicious. They may, have some anxiety about what's going on. We've seen some protests outside Dodger Stadium of people concerned about this vaccine. I guess my question to you is, I know the mission is to vaccinate everyone. I also know that your mission as a great leading mayor in the world is to work on things like climate change. I just am interested in how you overcome people's doubts, how you bridge that so that people are willing to do what whether there's something left tomorrow when we have the next pandemic, when we have to make hard choices about climate change, how you can kind of overcome some of these that are resisting this because they don't trust government.
Well, I think that's, the distrust of institutions, not just government, whether it's media, government, business, religious institutions, some of our main ones that always pulled over 50%, like law enforcement, which is now less so. This is a trend nationally. And to me, the best lesson I ever got was from my predecessor on the city council, who, when I became a city council member, she told me, you can't dismiss people's fears. You have to understand them. Now, there's some people you'll never convince. It's very difficult for me to unwind somebody's conspiracy theory. But the majority of people are not conspiracy theorists. They're doubters. They have reason to distrust, and they have mistrusted in the past. So when you have to listen to why people, for instance, the African-American community, can go back to Tuskegee, can go back to experiments that were done, the medical profession has to earn that trust every single day. But when you can let them know that an African-American woman helped create the vaccine, and you can name her and point to it, when you can go to a neighborhood clinic or even a celebrity that people trust who's getting the vaccine, him or herself, these are ways to change those attitudes. So you can't dismiss people's fears and tell them you're wrong, you're stupid, anything like that. They usually come from a decent place. And then you have to give them the reality. You know, I had my second dose this past Friday. And to me, not only has it been safe, I feel incredibly well protected now. I feel ready to re-enter the world, to hug family members I haven't been able to for a long time, to be able to go to a ball game and get on a flight and do those things that made life beautiful in the coming months. So I think you have to talk very personally to people. You cannot make this about statistics, and you certainly can't say, hey, I'm with the government, I'm here to help. You have to say, look, I'm your neighbor, I'm a human being. Let me tell you my experience, and hopefully you can do the same.
Is the Johnson & Johnson vaccine something that's going to be a game changer for you in terms of distribution? I know we've had Moderna, we've had Pfizer, but you still have had, sort of a massive scramble, for supply, frustration with people trying to kind of, get on websites and line up. Does the J&J push this to a level where there'd be greater comfort in people accessing appointments?
I think it helps in three ways. First of all, it's more supply, and it's starting very small, but it will ramp up quickly with over 100 million doses, 100 million people worth by mid-July is what they've promised. Second, for people who don't like getting shots, it's one and done. And third, it helps us with vulnerable populations. For instance, our unhoused, unsheltered population here in Los Angeles, which numbers about 30,000 people. We can go to a homeless encampment, give somebody, that shot, and not have to worry about coming back for a second shot. We can go into places. This could be great for our youth later on if it's approved for young people, because you don't have to worry about tracking them down or doing it twice. It reduces the logistics. But, we have three phases of this vaccine moment. One right now that we're in is not enough vaccines. That's going to quickly change. Phase two is going to be not enough capacity. We're going to have so many vaccines. The question for every jurisdiction is, do you have the capacity to deliver it and deliver it quickly? And then phase three is going to be not enough people. And to your point earlier, how do you convince those who are skeptical or want to wait? I think those are the three phases we're going to go through. In Los Angeles, we're hustling every day. I'm still going to start a reality show called Vaccine Hunter, because I'm looking for every place. We sent our firefighters to a whole bunch of grocery stores a couple weeks ago, 50 of them, just to get 1,000 extra doses in a single day. But soon, if you just do the math, Johnson & Johnson will help. Together with what Pfizer and Moderna have promised, we will have more vaccinations than there are people in the United States of America. So I hope we can use that to help the rest of the world get inoculated as well. And I think that if we have that capacity built up properly, by midsummer, all the adult population that wants to get a vaccine will have a vaccine and be vaccinated in America.
Mayor, we're just a little over a year now in this national trauma of this pandemic, and we saw the early stories around scrambling for PPE. We saw the stories of, what it took to actually put billions of dollars. And so parts of that story are great. I mean, it's miraculous that we have these vaccine options. I mean, I want to underscore it. Usually takes years. You've had it in less than a year coming in. I guess my question to you, as we've moved from one presidential administration, the Trump administration, to the Biden administration, has the experience of the city of Los Angeles changed at all, or is it pretty much continuous from one administration to the next when it comes to the vaccine?
The good part is continuous. I mean, it was the previous administration and this administration that have worked with private sector and researchers to develop this miraculous, pace for vaccines to be developed. That is really a remarkable moment in human history, the fastest ever. And we're lucky to be complaining about whether we're waiting an extra week or an extra month for that dose when a lot of nations don't have it. And in the past, this would have had to burn itself out, killing millions more people. Secondly, there's always committed people that are inside the bureaucracies who are not politicized. But I'll tell you, third, what has changed is that this is no longer weaponized. The partisanship, which there's so much to be proud of that America has done, from the vaccine distribution to some of the work that we've done to help people out when both houses and both parties came together. But there was so much that was weaponized and created partisanship, and so much to be ashamed of. A country that's the richest in the world, that was most prepared, according to the WHO, for a pandemic, has, with just 5% of the population, 20% of the deaths. I don't care who you are or what conspiracy you believe, those deaths don't lie. 20% of the world's deaths from COVID, with just 5% of the population, 4 times higher than what we should have done, and maybe even 10 times higher than a rich country should have had. So there is that marked change with this administration speaking straight science, facts, collaborating with us in an even better way, and not just saying, hey, we did what we could. Now it's up to the cities and the states to figure out the rest, which is a message we got all the time with the previous administration. That is the opposite of what we're hearing now. They said, we're here to help and to stand up sites in your city to help you get what you need, to accelerate vaccines, and to be a partner in helping with the economic assistance directly to our cities as well as to our cities' people, which the previous administration almost went to war with.
Eric, let me just ask you finally. I mean, we've had the pleasure of talking a few times over the years, and I've always enjoyed it. I tell people, you're one of America's leading data mayors. I mean, data. You've moved the various divisions of the city into data centers and being familiar. You just talked about reaching people on their cell phones if they don't have, high-speed internet access and whatnot. And I guess I'm interested in the future. That is what we're learning now in reaching communities that have been marginalized, that had not been online, that had not been getting information. Are we going to be more resilient in the future because of this experience? And is LA able to consolidate that in a way from a data perspective?
Absolutely. And I'm so lucky to work with some of the best leaders in this inside my administration and city. Harvard University just honored us for our technology and data work inside the pandemic, and was very moved by that. But we've got to simplify this. If Google can figure out a single login for all the different things we do, why can't a city? And that's what we're moving towards in Los Angeles. Have a single login for whether you're paying your electricity bill, whether you're getting a library renewal, or whether or not you're getting financial assistance from a federal program to help pay your rent. And that same login should help you get a vaccine appointment, should help you with your healthcare needs, should allow you through a mobile device to really get what you need, because the world has already moved that way, but government has been much slower. And we've 3 out of the last 4 years been the top digital city in America, #1 open data city in America. I always say data will set you free and empower people to use it, but simplify it, because most people are on their mobile devices now, and we're still programming like it's 2004, and we're all on a desktop at home with a semi-high-speed broadband connection. That's not how a lot of America lives. And yet, for $50, we saw that story of a young man in New York who took 5 different appointment systems, coded something, and simplified it for the people of New York. Those are the sorts of people, next generation coders, we should be tapping to simplify and to bring all of city services together to improve people's lives, not just convenience, but sometimes in pandemics like this, literally save their lives as well.
I can't help it. I got to ask one more.
Sure.
Yeah, I love show and tell with mayors, as you know, and it's just great that you were sharing so many of the things you've done. One of the other cool things you've done, which I'd love that DC to hear about, and New York, midnight vaccine clinics. Do you know about tell us about midnight vaccine clinics?
Sure. We want people to come and get vaccinated however is best for them, whether that's very late hours and kind of a way that people can take it almost as a social event, as a rite of passage, something where hardworking people can come late or young people can come and do that. We're turning, our work, whether it's a Dodger Stadium in a mega site or kind of having a more festive environment to come late at night, as you would in the past go out to a date or go meet friends, to be able to have your vaccination taken care of. So we're working with local partners to do that. I'll work 24 hours. I'll drive a car to get a vaccine to a certain corner that's underserved. I'll set up the biggest sites in the world. I'll do whatever it takes to make sure my people's lives are restored as quickly as possible. And if you can have a little bit of fun with it, why not?
Well, thank you so much for that, Mayor Eric Garcetti of Los Angeles. I always love talking to you. I mean, I think Los Angeles is one of the greatest cities in the world. It's a real pleasure to see what you're doing and hear what you're doing, in particularly reaching people. And I want to tell everybody, our job today is not to necessarily think about how we reached everybody who's already going to be in line, who's already going to have access. It's really kind of getting beyond that and figuring out how we keep doing that over and over again, and making sure we have an inclusive health system. So, Mayor Garcetti, thanks so much for joining us.
You bet. Always great to be with you. Thank you.
Well, that brings us to the end of our program today. A big thank you to Granicus for its support and all of you attendees for joining us for these conversations today. They've been great. For those of you who missed any of them, we're going to have our video of all these conversations up shortly on our event website at The Hill. I'm Steve Clemens. Stay safe and be well.